I'm Elizabeth Bailey. I'm the director for the Consortium for Affordable Medical Technologies, and we're based at Mass General Hospital in the US. So we are particularly inspired by the public health challenges in India, and while there have been tremendous challenges or tremendous progress made, there's still much to do. When we look at the Sustainable Development Goals, whether they be in maternal and child health or non-communicable diseases, there's still much to be done. If we look at rural communities, and specifically bottom of the pyramid, there's obviously quite a lot of disparities across different populations and different communities in India. And so I think where we're really focused is looking at areas where we can expand access to healthcare to those that don't receive quality healthcare. We're interested in improving the quality of healthcare that exists, and also making it more affordable. And so I think across access, affordability, and quality, we think there's tremendous opportunity for growth. We're also particularly interested in the connections between a country like India and other low and middle income countries across the globe, and really see an opportunity for innovations that are developed here to first and foremost impact the Indian marketplace and Indian communities, but then we think there's a more global opportunity for the innovations coming out of the country. So CAMTech really serves as a bit of a neutral broker where we connect very diverse stakeholders in the ecosystem. So we really take an ecosystem approach by bringing together everyone from academic institutions to government organizations to clinical organizations and NGOs, as well as industry. And we bring all of those different stakeholders together to focus on specific public health needs. And our role as a neutral broker has allowed us to bring groups together that don't traditionally work together. They often, in technology innovation and health innovations, take place in various silos. And our platform allows all these groups to come together on a neutral, open innovation platform and focus on innovations that are specific to India. And so I think that's something we're really committed to, is this idea of local innovation. This Make in India movement is kind of a perfect fit for us, because we think the people on the ground in India who know their problems better than anyone else should also be engaged in finding solutions to those same health problems. And we've seen this incredible talent pool in India emerge that's really interested in making a difference in healthcare in their own communities, and they're excited to have a platform where they can come together and work in this very diverse community where we bring together clinicians, engineers, and entrepreneurs to work in concert. And from CAMTech's perspective, we think this is really the future of healthcare, where clinicians sit side by side with engineers and entrepreneurs to co-create solutions that are going to be impactful in these communities. So the first thing we look for is really a passion to make a difference. And we do run an application process, a pretty rigorous one, where we look for people's motivation. Why do they want to get engaged? We also ask, what kind of skills do you bring to the table? And for us, that's been very exciting to look at the types of people joining the CAMTech platform and the CAMTech community who didn't necessarily think of themselves as an innovator. They had a very specific skill set, but what we found is they bring that skill set, which is complementary to all these other skill sets around the table, and together they're so much stronger in terms of the innovation output and the things that they're able to accomplish by working in these diverse teams. So there are three main groups that we want. We want people with clinical backgrounds, but those are not just doctors. Those are nurses and ASHA workers, and really all of the clinical people involved in providing care to patients. And we want the diversity of caregivers, because that's the reality of how care is delivered. It's not just doctors. And so we really want to expand the voice to include all of these clinical voices. The other group is engineers. who have very strong technical background, and those can be software engineers or hardware engineers or computer science engineers. And we are interested in, you know, everything from coding to can you actually build something? And you know, so we see engineers coming from many of the leading technical institutes from all across India, and that number of institutions is really growing by leaps and bounds. And then the last group, but certainly not the least group, is entrepreneurs. So ultimately, these innovations need a business to get them into the market. And you need that entrepreneurial talent to be sitting at the table right from the beginning. So sometimes what we see is a technology looking for a clinical problem to solve. A better case is when we see a clinical need that drives a technology innovation, but what we see much less of is the business questions being asked right from the beginning. And so that business component is critical to understanding, can you manufacture something at a reasonable cost? Can you sell it? Is there a business model that will sustain this innovation in the marketplace? And so it's really that business question along with the clinical question and the technical question, that all those asked at the same time, that drive a more effective innovation process. And when you can't answer whether there's a clinical need or whether there's really a technical solution to something or an innovative solution, or whether there's a business model, we want those ideas to fail really quickly. And our hackathon model actually enables us to do that, because it's a very sort of risk-free environment. People are not at their jobs, so they're not worried about losing their jobs. They're not at their academic institution where they're worried about whether they're going to get a good grade on something. And certainly they're not in their clinical practice where a patient's life is at stake. And so there's really an opportunity to expand your horizons, try new things, and not worry if you're going to fail. And so that's been very exciting for us, and I think very exciting for our innovators to come and engage in this innovation process where they can try new things without the fear of failure. So we have an application process where we ask people, are you committed to making a difference in healthcare? Do you have a skill to bring to the table? You don't have to have all the pieces of the puzzle, but we want you to have one. Do you have a specific challenge that you want to work on? And I think lastly, are you willing to make a commitment to see a process through? And if all those things are met, we want you to come into the CAMTech network and be part of our community. We've been particularly excited in India because in just the last year, so the CAMTech India program officially launched last July, and it's a program that's supported by USAID, the Baca Foundation, and the Omidyar Network. And in just one short year, we've seen over 600 innovators go through our program, and 5 new ventures have launched. And those new ventures were launched within weeks and months of the hackathon that we ran. And so one of the ventures that launched was a winning team at the first hackathon we did on maternal and child health, and it's called Baby Steps. And it's essentially a mobile app that empowers parents to track the development of their child from a very early age. So because what sometimes can happen is a child will fall off their growth trajectory, but parents really won't know whether it's worrisome or what they should do about it. And so by plugging in those data points, parents are empowered to say, you know, we really need to go see a doctor, or something seems like it might be wrong. So it's putting the right information in the hands of parents to help better care for their children and get their children to a clinical care setting so that they can receive care if they in fact need it much earlier than if they don't have those information tools. And that's a technology. It's called Baby Steps. It launched out of our first hackathon, and it will be on the market in just one more month in November. So I think one of the things we've seen, whether it's it's getting prototypes developed faster, products into the market, or new ventures launched, that we're seeing this whole process of health innovation being accelerated by CAMTech. One of the most exciting pieces of the online platform is that it very easily and seamlessly allows collaboration across different geographies. So our networks right now are concentrated in the US, in East Africa, in Uganda, and India. And actually our biggest network is here in India. But we've seen some exciting cross-pollination of ideas between India and East Africa. And that's something that the online platform will be able to enable much more of. And some very exciting innovations have come out of those collaborations. And our goal is to respond to the demand of the innovator community. And one of the demands is we want opportunities to work with people outside our specific geographic region and certainly outside our specialty. And so this gives you an opportunity to collaborate with people in different regions of the world and in different specialties. So if you're a clinician and you want to connect with an engineer who can help you build something, or a business person who can help you get it to market, this platform is the perfect confluence of all these groups coming together. Without all the constraints of what we experience with our in-person events, that we simply can't keep up with the demand. And this online platform is really in response to that demand.